Hi, and welcome to another episode of My Maternal Notes, where I talk about the things that I've seen, experienced, and been impacted by while traveling around Ghana covering stories on maternal mortality. Can you imagine being pregnant, in labor, and getting on a bicycle, or getting on a motorcycle, or perhaps walking for miles and miles and miles until you found a clinic or medical facility, or maybe you're being carried by fellow villagers. These are all things that many women in countries like Ghana experience every day. It may sound unimaginable, but it's true. The idea of getting on a bicycle or getting on a motorcycle is not something that a pregnant woman should actually be doing. If you've ever been pregnant, can you imagine any of these scenarios? In many parts of the world, there are very few ambulances, if any at all. So when you go to remote areas, finding a way to get to the hospital, especially for a pregnant woman in labor, can be a challenge. Even in the major cities, for example in Ghana, in the capital city of Accra, there are only 11 ambulances from the National Ambulance Service that provide services to over 4 million people. 11, can you believe it? Now there are some private ambulances that operate throughout the city, but the problem with those is they often aren't used for the purpose that they're there for. Sometimes they're used simply for transporting dead bodies like a hearse would do, or people are using them for personal reasons. So the matter of fact is, for the National Ambulance Service that services the country, in the city of Accra, there are 11 ambulances servicing over 4 million people. So what do people do in the state of an emergency? They take taxis, they get rides from other people that they know, or walk, getting on motorcycles, all different ways to get to the hospital. Now I'm going to talk about the remote villages for a moment, because in the remote villages, most of these places don't even have an ambulance. In some villages where they have clinics, they won't have a car or an ambulance, but they might have a motorcycle that's been designated to them from Ghana Health Service, like the one that I saw in Kutebwem in the Volta region. Now for remote villages where they have poor road infrastructures, or people don't have cars, or they only have bikes, what is the option to get to the hospital besides walking? So you can imagine I found it quite interesting when I was doing some research on maternal news and came across this really genius idea that a couple of Americans created to help transport people to the hospital. And I thought it was amazing because it definitely would be a viable option for pregnant women in labor in remote villages in places like Ghana to be transported to a clinic. Let's take a look at it.
In remote areas, current methods of transportation for those who are injured, disabled, or pregnant is not only uncomfortable, but inefficient and dangerous. People can only travel with what is available to them, and sometimes that means simply riding on the back of a bicycle, inside a wheelbarrow, or in the arms of a loved one. Unfortunately, because of these inadequate means of transportation, many people die before they even reach the nearest clinic. With the right solution, these casualties are entirely preventable. Introducing the Zambulance. Simple, affordable, and locally built. With a Zambulance, the patient can be comfortably and quickly transported from their home to a clinic. The time saved can mean lives saved as well. It is housed in a weatherproof canopy that facilitates privacy, comfort, and protection. And it has a strong, easy to attach hitch that connects the Zambulance to any bicycle or motorcycle. Having one Zambulance at a clinic will save up to 1 life every 9 days. We have always existed to improve the quality of life, but now, with the Zambulance, we have the potential to actually save lives.
that so cool? It's not a vehicle like a proper ambulance, but it definitely is a tool that can be used to transport pregnant women in labor to the hospital. Now, if you're interested in supporting this project, just go to their website and you can contact them directly to find out how you can make a donation to support this project. Right now, they're not actually operating in Ghana, but it is in future plans. With the support of people like you, they can grow and eventually be across the continent of Africa and in other parts of Asia and South America, different places around the world that could utilize a tool like this. Thanks for watching another episode of My Maternal Notes, and I look forward to seeing you again.